Yeah, so I think that the challenges in the really early stages is that very often FTD patients will, especially the behavioral variant, will be classified as AD or treated on the AD path. Of course, they won't respond to the anti-amyloid. I mean, they wouldn't be on anti-amyloid therapy if they didn't have the amyloid markers as well, but generally it's tau that is considered to be more prevalent or more involved in FTD, and hopefully we're going to have some treatments for tau to help, alleviate some of the issues associated with tau. But I think, you talk about AD being this really the big category, but the estimates are anywhere from 20 to 30% of those patients who are classified as AD are not in fact AD. Sometimes with Lewy body dementia, we often don't know until postmortem. And of course, you can have mixed pathologies as well. But I do think frontotemporal dementia, the full neuropsych assessment with a qualified neuropsychologist can ferret out, particularly if you're looking at the difference between the PPA and the BV. We also have the link with FTD and ALS, which we have genetic markers for that. That's a very unfortunate disease progression as well. So I think that the EEG markers just add to the clinician's toolkit of things that they can do early in the process. I think sometimes with frontotemporal dementia, it's the caregivers or the family who really need to be involved in the neuropsych assessment or the clinician interview, because they see things that the patients themselves don't, especially in the behavioral variant. So the behavioral variant patients start acting impulsively, they have no filters anymore, so you go to a restaurant and they don't like the food, they're going to call out the waitress or say whatever it is, and you might just write that off as, well, Dad's a grumpy old guy, but those kinds of pieces of information are very helpful in the diagnosis as well. But what we're hoping is that these electrophysiological profiles will give a more and more definitive set of biomarkers, and we're providing the clinician with a set of biomarkers, primarily those that we've associated with mild cognitive impairment, Alzheimer's, and Lewy body. Now we're adding to that the frontotemporal dementia. And as I said, we've already had discussions with one of our clinicians who said, what do you think about? Well, that looks a lot like our behavioral variant fronto. So it's early stage. We can do pattern matching with AI if we have more, additional data. So one of the things we're doing at this meeting is reaching out to many researchers and trying to acquire more data.
Yeah, and obviously